10 at 10 starts now.
Nobody needs to be bothering you with things like that. You're supposed to be concentrating on healing and taking care of yourself at that point.
For more than a year and a half, patients at Fairview hospitals were hounded to pay their bills as they were seeking critical care. The 10 biggest stories of the day at 10, I'm Randy Meyer. The Attorney General exposed the practice, and now it's attracting congressional scrutiny as well. Senator Al Franken is holding a hearing on the matter tomorrow, and our Tim Blotz talked with one of the people who will be there to tell her story. Tim.
Well, Randy, Fairview Hospitals hired Chicago-based Accretive Health back in March of 2010 to manage its revenue cycle. And as a part of that contract, Accretive placed staff members in all 10 Fairview hospitals. And a big part of their job was to get people with overdue accounts to pay their bills on the spot. And they were serious. The Attorney General's report found internal Accretive documents from one manager who said, "We've started firing people that aren't getting with the program." And then there was an employee in an emergency room who told the AG's office, "We were told that if we don't get money from patients in the emergency room, we would be fired." Well, one former Fairview nurse says these aggressive tactics even happened to her own daughter.
Little Evan hadn't been feeling well.
When 13-month-old Evan Augustine went to Fairview Ridges Hospital last year with encephalitis, his grandmother, Jean Ross, went with him. But in a few brief moments when Ross left the room, her daughter got a visitor.
And she said, some woman came in here and she looked at me and asked if we could pay part or all of our bill now. And I said, your bill? And I said, what did you tell her? Well, I told her I couldn't even pay the copay. And I said, okay, all right, well, let's just deal with the baby right now and we'll deal with that later.
It's a pattern that was uncovered by Attorney General Lori Swanson in a 6-volume compliance review. The bill-collecting practices of Accretive Health were so aggressive, the report found, that internal emails from April of 2011 describe how 2 patients left the emergency room at Fairview Southdale without being registered. At Ridges, 2 more patients left before seeing a doctor. To Jean Ross's family, it didn't just happen once, but twice. When her daughter returned to Ridges in February to give birth to her 3rd son, Emmett, she was again met by a bill collector.
And within 24 hours, not even a day after she delivered, the same thing happened, only this time it was up in her room after she had delivered the baby. Can you pay all or part of your bill now? She said no, and she sent her out of the room.
What's shocking and disappointing to Ross is that she worked 35 years at Fairview as a nurse. But she was laid off in 2010 before Accretive was brought in to help Fairview improve its finances. She intends to tell Wednesday's Senate hearing that she believes this is no dignified way to provide health care.
While I can sympathize with them needing to keep their finances in order, this is not the way to do it.
Now, there have been a number of changes at Fairview within the past month. Fairview has ended its revenue cycle contract with Accretive, and the board has also not renewed the contract of its CEO that hired Accretive. And for the first time, we're going to get to hear from Accretive in detail tomorrow. A company vice president will testify at Senator Franken's hearing, along with the interim CEO of Fairview. We're going to be there to bring you the story coming up tonight here on Fox 9. Randy?
All right, Tim, thank you.
Ms. Ross, please go ahead with your testimony. Please do keep it to 5 minutes.
Senator Franken, thank you for holding this important hearing on behalf of patients, family members, and nurses at Fairview and all over the country. My name is Jean Ross, and I am a registered nurse. In December of 2009, I was elected co-president of National Nurses United and currently still hold this position. Previously, I worked as an RN for Fairview Southdale Hospital in Edina, Minnesota, for over 35 years. The following is my personal account of 2 different incidents involving the Fairview healthcare system in the past 2 years that affected my family and me. In 2010, my infant grandchild was very ill over one weekend. On a Friday and then again on Saturday night, I accompanied my daughter and the baby for several trips to the emergency room. This was at Fairview Ridges Hospital in Burnsville, where he was eventually diagnosed with encephalitis or meningitis and was then transferred to Minneapolis Children's Hospital. Our time at Ridges was made especially jarring, however, by the actions of some ancillary personnel who had nothing to do with the care of our young family member. My daughter was extremely worried. She had many questions, but she was holding up pretty well until I left to use the restroom. When I returned, she was holding the baby and sobbing. I assumed she must have received some very bad news about the baby's condition. Instead, I learned that while I, the nurse and doctor were out of the room, a woman had come in and asked if my daughter was willing to pay all or any part of her bill now. My daughter told me no, she could not. As background, my daughter and her husband are among many families hit hard with medical bills and changes to insurance coverage. She certainly did not need reminders of her financial position while under the stress of worrying about the condition of her youngest child. Now fast forward to February of this year. My same daughter's just delivered her third child at Fairview Ridges. Within 24 hours, a Fairview representative visits in her room with the goal to extract some or all of the payment for the bill. According to my daughter, this woman at least was apologetic. She even confessed this is the least favorite part of my job. Senator Franken, I spent much of my time at Fairview Southdale working in the ER. While there, I witnessed no such behavior. This kind of, I call it ruthless corporate behavior, just wouldn't have been allowed. A nurse's main focus is to advocate for patients and families. We urge patients to put other worries aside and to concentrate exclusively on healing. They certainly don't need the added burden of being pressed for payment while they are being treated. Every nurse wants to be proud of the work we do. We expect policies that allow us to do our job properly. We want to be able to speak well of the place that employs us. Programs or policies that encourage or require bill collection while the patient's being treated are, I believe, unethical and don't belong in any healthcare setting. It does not reflect well on any institution, and I'm very disappointed in the system that employed me for so many years. I'm even more aggravated at an overall healthcare system that doesn't allow universal access to all who are vulnerable, and which drives providers to this misguided and disgraceful behavior. This is exactly why our trusted and proven system of Medicare should be expanded so every man, woman, and child could be included in Medicare for all. I thank you for your time.
Thank you very much. And we'll handle that last part in a different hearing.
Just a hint.
Ms. Ross, thank you so much for your testimony. As an emergency room nurse with decades of experience, what do you believe is the most important role of a nurse?
Our main role is, always has been, to advocate for the patient. And that's what I find so disturbing, aside from the fact that it interferes with the patient's care. The nurse is the person that's coordinating the care with their patient. And I have had diagnosed people, if a certain is told, ask, is it okay to go in a room now and talk to that patient? That's not even an emergency room, that's up on the unit. I have had people from medical records or the triage area in the emergency room, let's say someone had to be rushed back, or they were having trouble breathing or having chest pain. Even those people need that information. It might just be a phone number, an address, etc. But they know enough to ask me or the doctor, is this an okay time now? Is that patient stable enough? To have a stranger come in without my knowledge as coordinating that patient's care or the doctor's is not just an interference, it's unethical.
Nurses are often the providers who spend the most time with patients in the hospital, and they almost always are. And in national polls, nursing often is rated as one of the most trusted professions. As their nurse, would you allow patients to be badgered for payment?
I would not. I think it's unconscionable. This is not the time or the place. And, you know, well, as I said earlier, I can appreciate that they have to collect monies in order to do what they do. But this is not the time or place. And over all the years that I worked at Fairview facility, this just was not done.
When you say it's not the place, you're saying the emergency room.
No, I'm not just saying the emergency room. I think any point of care, when you're hospitalized, you do not need that extra burden, that stressor. It shoots your cortisol levels, and yet we don't need that. That's not part of healing.
Ms. Ross, the Attorney General's report says that maintaining the privacy of patients' health information is critical, because otherwise patients would not have candid conversations with healthcare providers. Did you find that to be the case in your years as a nurse? What could go wrong if you don't have all the information?
If I don't have all the information,
The doctors don't have all the proper.
well, obviously a person, a patient, is a complex human being. You need all that information. I am a little disturbed, and I noticed this too when I started reading the consent for treatment forms, because I read them for my parents who are elderly now too. And I did notice that over the years, the Fairview consent for treatment form had changed. When I was last in with my father, I asked who this third party might be that needed this excess information. I'm used to, obviously, you give it to other physicians, other people who handle your care, and to insurance companies who would have to process your bill. But I asked who is this third party? And I was told those poor people at the desk, they don't know. What the lady said to me was, quite frankly, ma'am, nobody's ever asked that question, and if you don't want to sign okay to this, you just put your initials there and say no. So we did say no. But it came, obviously, after I started reading about what's going on here, I believe that's the third party they're talking about. And I do not understand why that pertinent medical information needs to be given to a third entity.
And if people don't trust that their information is going to be secure, they'll be less likely to give out personal information.
Exactly.
You, as a nurse and the doctors, may need to know what medications that person's on, what conditions they have, so that you don't prescribe. The doctor doesn't prescribe medicine that is
Right.
will interact badly with other.
Exactly.